In the shadows of modern medicine lies a devastating disease that continues to claim millions of lives worldwide each year. Tuberculosis, often abbreviated as TB, may seem like a relic of the past to many, but its persistent grip on humanity is a stark reminder of the challenges posed by infectious diseases. Despite advancements in treatment and prevention, TB remains one of the deadliest infectious diseases globally, killing an estimated 1.5 million people annually. The grim reality is that if left untreated, tuberculosis can ravage the body, cause debilitating symptoms, and ultimately lead to death. Tuberculosis is a bacterial infection caused by Mycobacterium tuberculosis. It primarily targets the lungs, leading to pulmonary tuberculosis, but it is not confined to the respiratory system. The bacterium can travel through the bloodstream, affecting organs like the brain, spine, and kidneys. This versatility makes TB a particularly dangerous adversary. The disease is transmitted through airborne droplets when an infected individual coughs, sneezes, or even talks, making it a silent threat in crowded or poorly ventilated environments. TB manifests in two primary forms: latent TB infection and active TB disease. In its latent stage, the bacterium lies dormant within the body, causing no symptoms and posing no risk of transmission. However, latent TB can spring to life, especially when the immune system is weakened, transforming into active TB disease. This is the stage where the disease becomes contagious and its symptoms, persistent cough, chest pain, night sweats, fever, weight loss, and fatigue, take a severe toll on the affected individual. While TB was once the leading cause of death in the United States, effective treatments introduced in the mid-20th century significantly reduced its prevalence. However, it has not been eradicated. In 2021 alone, there were 7,860 reported cases in the U.S., equating to an incidence rate of 2.4 per 100,000 people. Globally, the statistics are far grimmer. Over 10 million people fall ill with TB each year, and the disease disproportionately affects vulnerable populations, including those in low and middle-income countries. Moreover, the rise of multidrug-resistant tuberculosis has added a new layer of complexity to its management. MDR-TB emerges when TB bacteria develop resistance to the most commonly used treatments, such as isoniazid and rifampin. Treating MDR-TB requires a longer and more complicated regimen, often with more severe side effects. TB's consequences extend beyond the individual. Families and communities bear the economic burden of prolonged treatments, loss of productivity, and healthcare costs. For patients, the stigma associated with TB can lead to social isolation, further compounding the emotional and psychological toll of the disease. When the bacterium affects organs outside the lungs, as in extrapulmonary tuberculosis, the consequences can be even more devastating. For example, TB meningitis can lead to brain inflammation, causing seizures or long-term neurological damage. Spinal TB, known as Pott's disease, can result in severe back pain and deformities. Adrenal gland involvement may cause Addison's disease, disrupting hormonal balance. These complications underline the importance of early detection and comprehensive treatment. Diagnosing TB is a multi-step process involving skin tests, blood tests, and imaging like chest X-rays or CT scans. Laboratory analysis of sputum samples helps confirm the presence of Mycobacterium tuberculosis. For those suspected of extrapulmonary TB, biopsies or fluid samples from affected areas may be required. Treatment for TB is both a lifeline and a challenge. The cornerstone of TB treatment is a combination of antibiotics, including isoniazid, rifampin, ethambutol, and pyrazinamide. Patients must adhere to these medications for 6 to 9 months to ensure the bacteria are fully eradicated. Interrupting or prematurely stopping treatment can lead to drug resistance, making the disease much harder to treat. Side effects from TB medication. such as nausea, rashes, or liver issues, are common and can discourage patients from completing their regimen. However, the consequences of incomplete treatment are far more dire. Healthcare providers play a crucial role in monitoring patients, managing side effects, and providing support to ensure adherence. Preventing TB requires a multifaceted approach. Vaccination with Bacillus calmette-guerin is used in many countries to protect children from severe forms of TB. While the vaccine is not widely used in the US, it remains a key tool in high-prevalence regions. For individuals at higher risk of TB, preventive therapy can be life-saving. This involves taking antibiotics to eliminate latent TB bacteria before they can become active. Infection control measures, such as wearing masks, improving ventilation, and practicing good hygiene, are also essential in healthcare settings and communities. Tuberculosis is a curable and preventable disease, yet it continues to cause immense suffering and loss. Raising awareness, ensuring access to diagnostic tools and treatments, and supporting ongoing research are critical to ending TB. At Dr. My, sharing medical knowledge, we are committed to educating the public about health challenges like TB. If you found this article informative, please support our mission by liking, commenting, and subscribing to our YouTube channel. Together, we can spread awareness and empower individuals to take charge of their health. Your engagement helps us create content that matters. Share your thoughts in the comments, suggest topics you'd like us to cover, and join our community in the fight against TB and other preventable diseases. Let's make a difference, one step at a time.